The UK prides itself on its National Health Service, which promises free healthcare for all. However, the reality is often different. Patients face long wait times and are forced to consult nurse prescribers in urgent care centers, walk-in clinics, and A&E departments.
One of the most significant issues is the correct diagnosis and treatment delay. Patients often wait weeks or even months for test results. This delay can have serious consequences, especially for patients with long-term illness.
Wrong diagnoses and treatments result in devastating complications and even death. Advice offered by non-medical school-trained nurses and teenagers employed as healthcare advisors using protocols created using algorithms is unethical, substandard care. These issues are not new. The NHS has been under strain for years. In 2005, a shortage of doctors led the Secretary of State in the UK to license non-medical school-trained nurses and chemists to work like doctors, diagnose, advise, and prescribe drugs.
Doctors who challenged this and raised concerns were victimized by the General Medical Council, which claims to protect patient care. The Government, Medical Council and the BMA promised to protect doctors and reforms, but they failed. Patients are being let down. The NHS needs real change, not just empty promises.
The UK government acknowledges the challenges facing the NHS. The new Health Secretary, Wes Streeting, is stunned by NHS failings and is determined to tell the truth about how patients and staff had been failed. Mr. Streeting has ordered an independent investigation into NHS performance in England. These reforms aim to address delayed diagnoses and improve access to care.
One of the key proposals is to upgrade IT systems and introduce AI-powered diagnostic tools. The NHS has seen countless reforms over the years by its predecessors who lived under an illusion based on theoretical idealism. They did not understand the practical realities of diagnosing illnesses and offering the proper treatment. The goal of every doctor is to make the correct diagnosis and offer the best treatment to prevent complications and death. The government plans to recruit more doctors and nurses, hoping to rectify the problem created by managers and administrators.
While these promises sound good on paper, many remain skeptical. Critics argue that the proposed changes are too little, too late. They point to the government's track record of reducing medical diagnostic errors and needless deaths by improving the quality of care in the NHS, which is poor.
The true test of these reforms will be their impact on patients. Will patients see shorter wait times? Will they receive faster and more accurate diagnoses? Only time will tell if these reforms are real change or just more talk.
As a doctor working within the NHS, I witnessed firsthand the consequences of these systemic flaws in 2003. I recall one instance involving a young mother with a brain tumor on a hefty dose of steroids who complained of sore throat, was unable to drink or eat, and advised Bon Jelly to soothe her throat. The nurse prescriber triaged her, not knowing this was an early sign of serious complication, categorized her case as low priority and sent her home. The community nurse, who had no formal medical school training or skill in clinically examining patients, was licensed to work as a doctor in the NHS.
A few days later, after Lubna collapsed, I was called to see her at home. After hearing she was living on 21 tubes of Bonjela every day, unable to drink or eat, and so very dehydrated and emaciated, I rushed her to hospital. The delay in making the correct diagnosis resulted in devastating consequences, making her suffer for 2 weeks and die. This is what I call negligent care.
This case deeply affected me, and so I made a protected disclosure because I recognized the dangerous reality of using non-medically trained professionals to offer diagnosis, advice, or prescribe drugs. The pressure on healthcare professionals to reduce waiting time is not licensing quackery. Discuss with doctors and listen to what they say, and not victimize them for defending their medical ethics. The emotional toll on patients and medical staff is immense.
The present health secretary, Mr. Streeting, clutches at straws, not knowing what he is up against and why the ship is sinking. One of the most concerning trends in the NHS is the increasing role of managers in clinical decision-making. While managers play a vital role in administration and resource allocation, their involvement in clinical matters raises concerns.
Qualified doctors are trained for more than 5 years in hospitals to clinically examine, diagnose and treat patients, unlike nurse prescribers, who observe doctors examine and diagnose illness in primary care in 14 days of training. In 1996, I published a letter in the BMJ that said, "Every person who seeks professional help tells me a story of the illness as they have lived, experienced and remembered it, and so it varies. My duty as a doctor is to listen and offer a solution, not a prescription. However, in the current system, their expertise is often sidelined."
Managers, driven by budgets and targets, may prioritize cost-cutting measures over patient well-being. This shift in power dynamics can have detrimental effects.
Due to budgetary constraints, doctors are pressured to follow protocol to diagnose and treat or deny necessary treatments. This conflicts between doctors' duty to their patients and the system's demands.
The World Medical Association Declaration states, "The doctor's fundamental role is to alleviate the distress of his or her fellow human beings. No motive, whether personal, collective, or political, shall prevail against this higher purpose. The culture within the NHS denies complete clinical independence in deciding upon the care of a person for whom he or she is medically responsible. They must follow guidelines and protocols to diagnose, investigate, and offer prescriptions." Doctors who raise concerns about patient safety or question management decisions risk facing a backlash that often results in post-traumatic stress disorder, which destroys their passion, finance, family, and their own life. More than 100 doctors who the GMC harassed have committed suicide in a decade. This culture of fear silences those best positioned to advocate for change. I've experienced this firsthand but survived, after voicing concerns about using nurse-led practice and walk-in clinics to diagnose and prescribe drugs. I was harassed and humiliated by the very institutions and some members of my profession I was defending. My experience is not unique. Many healthcare professionals remain silent, fearing for their careers and reputations.
This culture of silence perpetuates the cycle of dysfunction. It prevents meaningful dialogue and hinders progress. To truly reform the NHS, we need to create an environment where healthcare professionals feel safe speaking up without fear of retribution.
My book, The Art of Self-Diagnosis, was written and published to empower changes, a vision for a patient-centered future. True reform requires a fundamental shift in how we approach healthcare. We must move away from a system driven by targets and budgets and towards prioritizing patient well-being.
This requires empowering doctors and patients, not hoping protocol to diagnose created using statistical significance. Doctors need autonomy to make clinical decisions based on the story of the illness, using their expertise and judgment free from undue managerial influence. They need the freedom and support to provide high-quality care without being bogged down by bureaucracy.
Patients need a stronger voice in their healthcare, not encouragement to complain against the doctor if their expectations are not met. They also need access to clear and concise information about their conditions, treatment options, and potential risks. They need a system that listens to their concerns and respects their choices. Click the QR scan to empower yourself to make informed decisions, reduce the culture of dependency on doctors, wasted consultation, and cost, and protect yourself from wrong diagnosis and treatment. Thank you.